You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
So I don't know, Dad, before we start, I don't know, do you want to just, maybe we can share that case study, and it's a personal case study because it's with Mom, and the benefit of the inflammation formula for her shoulder. I don't know if you want to.
Oh, yeah.
Why don't you just tell that story? Because it's, it's funny because a lot of the supplements that we formulated, obviously were for clinical reasons, but some of them were for us, like personal things. The enzymes and the probiotics were formulated around my history of digestive issues and stuff like that. But Mom has had the shoulder thing going on for a while. I'll let you tell it because she was telling me yesterday and it was fantastic.
Well, I think it was 2 years ago, that she broke her hand and tripped in Florida and broke her hand. And then, of course, when she got back to Sudbury, they put it in a cast for, I thought too long, but didn't matter. And then she developed, because she was using her other arm all the time, she developed a very sore shoulder and actually became a frozen shoulder where she could not lift her arm, like higher than this. She couldn't get it up at all. And then the worst thing was not only the loss of motion, but the pain. And for almost 2 years, like trouble sleeping, especially she couldn't sleep on that side, but even not sleeping on it, in the middle of the night, she'd wake up, I'd hear her. And, she couldn't get that motion plus the pain, a lot of pain. And, you name it, she tried it. And even the inflammation formula, she did take it, but she would take it in a low dose. And then, I don't know, it wasn't for me. She just decided, you know what, I'm going to really try this. So she did 3 days in a row. I don't know why she said she put 14 on the chart, but she took 14, because if you look at the label of the product, it says if you have, real pain and inflammation, then because this is what I found clinically in the office, take 8 a day for 7 days. And I think, Brandy, even your mother, if I'm not mistaken, in her knee or whatever, I remember her telling me that really worked for her. But anyway, okay, I could be wrong. I'm a senior. But so my wife said in her head, I'm doing 14 a day. Throughout the day, she took a total of 14. By the third day, lift her shoulder at 100% and no more pain. And that was, a month ago, maybe?
Yeah.
5 or 6 weeks ago, I think now. And so...
Yeah, I know she was telling me the story. It was fascinating because she had a hard time for a long time with her shoulder. So anyways, just one of those stories
Well, I always call Mom our laboratory rat.
Oh, yeah, 100%. 100%.
She doesn't like that when I call her that.
No, 100%.
There's nothing that we don't bring on the market
that she doesn't test.
that because she has that sensitive
stomach
system that, it's like you're in a lab. So
yeah, for sure. Yeah. All right. So we wanted to start off just by sharing that story. All right. We got a lot of people on here. So Brandy, whenever you're ready.
I have an anonymous question. How can I raise my WBC?
White blood cells. Well, a couple of ways. I'll let you start this one, Dad. You deal with this.
Well, vitamin D.
Yeah.
Vitamin D. Think of the vitamins that specifically are good. I mean, there are a lot of things good for your immune system, but when you have a low white count, oftentimes too, by the way, it can go with anemia, because you can have a low white count and a low red count. It doesn't necessarily mean it's pathological, but you can be on that area where you don't make a lot of white blood cells. So here's a couple of things. One, you're usually, not always, but usually low in vitamin D. You're usually low in vitamin A. because that's very important for your immune systems. And you could be just don't make a lot of blood cells total. And one of the ways you make good blood too is by, that's why we, in our blood boost, what we do is we put everything in there, every nutrient that you can think of and every vitamin that you can think of, because it does build blood, and it just doesn't only build red blood cells, it helps to build your white blood cells in your immune system. But generally vitamin D, vitamin A are the two that I would say that you should, really look at.
Yeah, and the only other thing I would ask is there any clinical significance to that, right? Was that something that you were having problems with, had a blood test, and they said, hey, your white blood cell count, like this person's always sick? Or is it just the person feels good, they went and got a blood test done, and the doctor came back and said, oh, your white blood cells are a little low. So again, clinical significance matters, to a certain extent, for sure. And one of the things that here's the difference between functional healthcare and traditional medicine. So traditional medicine a lot of times looks at numbers, the actual amount, and that's it. It's high, low based on this number. Vitamin D, high, low based on this number. Where functional medicine, we're like, all right, do the ones you have, are they doing their job properly? That's the first thing, right? You can have enough red blood cells, but if they're not doing their job properly, a person can have symptoms of anemia, even though they get blood testing and it's like, everything seems to be normal. So the questions, you always have to ask the question is, what's the reasoning or the symptoms behind the question? Because that provides a lot of insight as well. But yeah, so as my dad mentioned, those are the supplements that we would recommend for that. All right, go ahead, Brandy.
Jerry would like to know, what is your take on molasses?
It's slow. We got bad sense of humor here. We laugh at our own jokes. We apologize. It's sugar. Unfortunately, it's just your body will break it down very similar to sugar. So if a person has any kind of metabolic disorder, it will mess them up, and it will cause a rapid rise in blood sugar, cause a rapid rise in insulin, will make them hungrier. It's not ideal, that's for sure.
Yeah, and the reason that especially in my day and age, we don't hear about it too much, but when I was a kid, blackstrap molasses were, that they give you that for anemia because you got iron from there. And but you know what, today with all the metabolic problems we have, and 88% of the population is metabolically challenged, I would say, I wouldn't touch it.
No. It's
better probably than high fructose corn syrup.
Yeah.
But in terms of spiking your insulin, I wouldn't touch it.
Yeah. On our scale, high fructose corn syrup is at the far end of one side because there's very little. There's almost nothing worse in terms of sugar than high fructose corn syrup, especially the way it's metabolized by the liver and stuff like that. But at the end of the day, we get asked this question a lot about various things. What do you think of honey? What do you think of maple syrup? We get asked this question, various things. And some things are better than others. For example, maple syrup can be, a lot, we used that stuff for a lot of things in the past. But if you're diabetic, maple syrup will give you a hard time because it's, at the end of the day, it's a sugar, right? So it's like honey, same thing. Honey's got a lot of therapeutic benefits to it. But at the end of the day, if you got diabetes or you got metabolic syndrome, honey will give you a problem. So that's generally how we answer those questions.
Yep. All
right, go ahead, Brandy.
Rita would like to know, what causes congestive heart failure?
That's a good question, Rita. So if you were to reverse engineer congestive heart failure to the very beginning, so my dad and I say this all the time: a person does not go to bed tonight healthy and wake up tomorrow with a disease. It could take months, years, decades to develop a disease, and congestive heart failure takes a long time to develop. That's a chronic issue that's been going on for a long time. So generally speaking, those types of diseases always start with what we call the 3 seeds of disease, always. Generally speaking, if I were a betting person, I would put my money on high circulating insulin is the cause of 90% plus of congestive heart failure.
Yeah.
It starts off at the beginning of the day as a problem with blood sugar / insulin. And over a period of time, they developed a fair amount of inflammation. And that inflammation started to damage the blood vessels, the endothelial blood vessels. That led to blood vessel disorders, and then eventually leads to congestive heart failure, fluid backing into the lungs, the whole 9 yards. But at the end of the day, that starts, in our opinion, with high circulating insulin, which is why the treatment for that a lot of times is, the metabolic reset that my dad talks about, ketogenic based diet or low carb diet, no question. But that's where we would say it starts.
Yeah. And the thing too, I would just add, remember what happens in congestive heart failure, besides what happens in the blood vessels, is what happens to the muscle of the heart. And your heart is a muscle. And, I bring this out because we see so much more of it today. Part of the aging process of the body. And one of the characteristics of that is a lack of CoQ10. And we love our Navital heart and brain because of the right CoQ10 in there, by the way. But if you bring it back even one more step, you'll realize that a lot of people, they eat, but they eat the wrong food. So Tony Jr., 100% right, because we are carboholics, we are vegetable oil olics, and we elevate our inflammation because our insulin is going through the roof. That's one way, and that damages the blood vessels. But when your heart lacks strength, the other one is the lack of CoQ10. And CoQ10, by the way, your body makes CoQ10. Your mitochondria make CoQ10 when you eat protein. You need steak, vitamin S at the Martin Clinic. It doesn't have to be just steak, but if you look at that, like, you see what happens if you're a carboholic, you usually don't get near enough protein in the diet, and you're not getting enough CoQ10. And I really look at the heart's strength, and that's one of the most important nutrients. And like I say, your mitochondria make it, your cells, your battery packs within the cells make CoQ10, but they make it based on your food that you're eating. And so you're deficient in one type of food and you're eating too much of the other one.
Yeah.
That's a very short Cole's Notes version.
All right, go ahead, Brandy.
That's hard for him to do. Keep it short form. This next question is from Sugar is Poison. Can probiotics and digestive enzymes cause excess stomach gas?
The short answer would be no. Digestive enzymes should actually help with that problem, because a lot of times any kind of fermentation in the gut is generally what leads to gas or bloating. And a lot of times what happens is that it's that food that starts to ferment in the gut because it's not being broken down. So a lot of people, as the food moves through the full length of the intestinal tract, you have different enzymes at different stages in the intestinal tract that help break down food. And some of these tougher to digest things start to move down, and then they start to ferment, and you can't break them down properly, right? So the short answer for 99% of the population, it would actually do the opposite. But again, for some people, I guess it could happen. I would usually say no. I mean, I don't know about you, Dad. I don't know if you have anything else you'd say on that, but
I mentioned it this morning. We all have a different fingerprint. There's 7 billion people on the planet, and all of us are different. And one out of gazillion, they say, I took digestive enzymes. It didn't feel good. Yeah, but 99.9% of the people, it was the opposite, because they don't have enough acidity in the stomach. they're not producing enough enzymes as we age, and medications or whatever. So there's a lot of reasons, but generally, no, it's the complete opposite of what you just said. Probiotics are meant, you need probiotics in the whole digestive tract. You need friendly bacteria. They're on your side. They help in digestion.
Yeah.
They help in the absorption of minerals and nutrients. So it's, if there is the odd exception to it, it's an odd exception to it.
Yeah. Okay, go ahead, Brandy.
Elaine says, my husband has very dry and deep cracks on his feet, heels, and sides. Is there anything you can recommend for this?
Yep.
Yeah, go ahead, Dad.
Well, I'd start with anytime you see anything in skin like that, I'd start in the gut, with probiotics for sure. I mean, the skin is just an organ, and what you see on the feet and dry, it's probably fungus too, because you see it as dry, but it was probably because of moisture that it all started, right? So, sweaty feet and whatever, and not healing and whatever. But internally, I would look at taking probiotics. I love high DHA oil.
Yeah.
I just find in skin, I love that fish oil, and this is very specific because it's very high in DHA and that healthy, long chain, most absorbable of the omegas. So I would do those two things. And I love oil of oregano right on the feet. I'd spray it on there, man.
And just don't, and that will force social distancing on people anyways. Now, one of the things that happens, which is interesting, one of the things that happens as well is if you look at how the protein and the collagen and the elastin in the skin work, is that skin is supposed to be somewhat flexible. When the skin starts to crack and do these things, that tells you as well that there's a problem with the nutritional aspect of the skin proteins with like I said, the elastin and collagen. So sometimes that could be an issue as well. Also, caramelization or like glycation of the skin could be an issue as well, which is could be a sign for some people that they're eating way too many carbs. And then obviously moisture of the skin matters also. And moisture of the skin could be anything from like hyaluronic acid, which decreases as we age. So there's a lot that goes on with that. So a dietary assessment wise, like my dad was saying, those kind of things is what I would look at. Go ahead, Brandy.
Joe would like more info on how to delay circadian rhythm.
How to delay?
Mm-hmm.
Well, you don't want to delay a circadian rhythm because so for the circadian rhythm is basically, it's fascinating because our hormones run on a 24-hour clock, which is interesting. I mean, what's fascinating is this is just a science nerd myself. I find this fascinating. There was a paper done, let's just say for some reason that we are able to colonize another planet. Like, they always talk about building a human race on Mars. What's interesting is that humans wouldn't survive because of our hormones. Our 24-hour hormones are tied to it's a circadian rhythm tied around the rising and the setting of the sun. Our hormones wouldn't handle it. We couldn't live like that, which is fascinating to think about. Our hormones, everything in our body operates on this clock, right? So one of the things that happens, and you see this a lot of times, especially with people that have a hard time sleeping, is they actually have the opposite. They have what they call a phase delay or a circadian rhythm delay, meaning they don't secrete melatonin at the right time. They secrete cortisol at the wrong time. They secrete cortisol at nighttime when they should be secreting it more early in the morning as they're waking up. There's no benefit to delaying your circadian rhythm because the circadian rhythm left on its own does its job. It's everything that we do with our dietary, with our stress, with our lack of sun, with our blue lights at nighttime that causes what they call a delayed or phase delay. And that's what leads to a lot of issues, a lot of problems for people. So the question would not be how do you delay it? The question would be how would you want to reset your circadian rhythm? That's the question there. And we talk a lot about that in terms of, like I said, eating, stress, cortisol, controlling your cortisol, putting either turning your blue light off at nighttime if it's causing issues or wearing those blue light blockers at nighttime, getting some fresh air, getting some sun, all those kind of things is what I would suggest. All right, go ahead, Brandy.
Al would like to know what causes sudden bursts of lightheadedness or dizziness.
All right, so that's a good question. So there's two ways to answer that question. One is, do you notice that when you're standing up from a seated position, right? If you're sitting and you stand up and you feel that, that's one thing. That's called orthostatic hypotension. That means that the blood volume in your blood vessels, as you stand up, your body can't control the volume properly and you get lightheaded. You see all those kind of things. That's typically an anemia problem or a dehydration problem for the most part. That's the two big things there. Now, if you get that upon exertion, if you get that that's a whole different ballgame. That could be a cardiac issue. It could also be, for some people, it could be migraines. Migraines can show up like that as well. That's a common thing for migraines, kaleidoscope vision, a whole bunch of stuff like that. So a few follow-up questions would be, when do you notice it? Is there a time of day you notice it? Is it after certain foods you notice it? Those are the kind of things that we would ask, because there's a lot of different reasons for that. But it's common. Medications cause that in a lot of people as well. There's a lot of medications people take that lower their blood pressure so that when they stand up, they get lightheaded. And then you look at their meds, you're like, yeah, well, that's what's causing it. So that's how I would answer that question. I don't know if you have anything else to add to that.
Well, just one of the things too that is nitric oxide.
Yeah.
And nitric oxide has a lot to do with blood flow because of what it does inside the blood vessel. And nitric oxide is something, again, it's another compound that your body actually makes. Problem is, as you get older, a lot of times you lose your nitric oxide. That's why we love Navitol. It really boosts nitric oxide levels, and certain exercise really do. So again, yeah, find out the root. But one of the things too could be you have very low levels of nitric oxide, and one vitamin that has a lot to do with that is B12. So you could be low in B12. Have that checked.
Yeah. Go ahead, Brandy.
Brenda would like to know if there is anything about schizophrenia that you both know. Her daughter was diagnosed in her early 20s, and her meds have caused her to gain a lot of weight.
Yeah, that's a tricky question, because there is definite 100% for some people. Again, this is not a blanket statement. This is not something that is true in every case. But if you look at the research, if you go look at the nutritional aspect of any kind of personality disorder or schizophrenia, it can be tied to low DHA levels. Like omega-3 levels could be tied to significantly low vitamin D levels, could be tied to significantly low or not optimized vitamin B12 levels. Or could be tied to as well glucose uptake problem in the brain. So they got some kind of issue with metabolizing energy in their brain, which again could be dietary. So you definitely want to, no matter what, you always want to optimize nutrition for your brain, especially when it comes to depression or when it comes to, like I said, a personality disorder or schizophrenia. You don't want to ignore nutrition. Will that fix the problem? No, but for some it does. But you don't want to ignore it, because there is a fair amount, if you look it up, a fair amount of research, as I mentioned, with those nutrients. You want to optimize those nutrients big time. And then, like my dad always says, leaky gut, leaky brain. So a lot of times, again, you want to look at a big chunk of brain health comes from gut as well. So you want to look at, do they have real bad leaky gut? Do they have issues with probiotics? Do they, so there is some stuff nutritionally that you should be doing. And then the weight gain is, unfortunately, it's a side effect of that kind of medication. There's no question with that. So I don't know if you have anything else you want to add.
Well,
to that?
you know what I tell you, and the problem is to try and get them to do it. Because if you're depressed or if you're schizophrenic, it's chemistry.
Yeah.
It's brain. Mostly from the gut, that's my opinion, because you got more hormones in your gut than you have in your brain. And the neurotransmitters, like Tony Jr. was saying, like DHA is one of the best. So if they would do it, I would have them on a very, very strict diet, like big time reset. And the reason is because if you can eliminate sugar 100%, I just find that any kind of like schizophrenia or whatever, there was a guy that I look at this, you're going back a long way, but who did a lot of work on this was a guy, a psychiatrist out of BC. His name was Dr. Abraham Hoffer, Hoffer. You can Google him, and you will see he did so much research on deficiencies in schizophrenia. But one of the things he talked about is sugar. And when people, and you avoid sugar, if you could get, in a clinical setting, he would do this. High doses of B12, high doses of vitamin D. He would literally inject these patients with B12 every day. It was amazing the results he got. He was vilified, of course, because, he wasn't talking about drugs. He was talking about, everything that we just talked about. So it's very complex, but boy, diet is big, and probiotics and Hoffer back in the 70s did not know about, he talked about the gut, but he didn't talk about the microbiome like we know it today.
No.
But it's amazing. And he's been dead now probably for 10 or 15 years, but he started the Orthomolecular Society. And it was, I did a lot of research with them, and I liked it. I got really good stuff.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.